Here is your question. Right, so if you have read and understood considering its surgical and optimization, kindly tell me if you can identify these structures. Can you please explain what you're looking at?
So mediastinal surfaces
Of?
for right and left lung.
Yes. Can you name the structures which pass through the
So,
hilum of
on
the
the-
lung in both right and left lungs?
Yes, ma'am. It's the principal bronchus, pulmonary artery, pulmonary veins, bronchial vessels, lymph nodes, lymphatics, and anterior and posterior.
I can't hear you. Is it my network or yours? You just disappeared. Can
Hello.
you please, okay, you just told me the structures, but then can you tell me the extent of the lungs, both right and left? Or the surface anatomy of the lungs on the skeleton or on the human
Yes,
being?
ma'am.
Surface anatomy of the lung?
Yes, ma'am. The apex of the lung. Yeah, we can mark it by the curved line joining sternoclavicular joint and 3 centimeters above point where it midpoint of middle and intermediate midpoint of medial 1/3 of clavicle. Anterior border lies from sternoclavicular joint up to 6th rib. On the left side, the anterior border deviates laterally at 4th costal cartilage to contain lung, to contain heart. Inferior border, it lies from in the from 6th, 8th, and 10th rib in the mid clavicular, mid axillary, and posterior vertebral line. Posterior border lies from spine transverse process of C7 to T10.
Okay. Can
Hello?
you, yes, can you please tell me the relations of nerves with respect to or with regard to hilum of the lungs? Which nerves are related with each lung hilum?
Yes, ma'am. Anteriorly phrenic nerve and posteriorly sympathetic and vagus nerve.
Okay. Can you tell me the course of the phrenic nerve?
Yes, ma'am. It emerges at the base of the skull, the anterior primary rami of C3, C4, and C5, and then it passes in front of scalenus anterior, just behind the vertebral fascia, and it descends into the thoracic inlet to pass in front of the hilum. On the right side, it lies on the right side of superior vena cava, right atrium,
Yes.
inferior vena cava, and along with inferior vena cava, it exits the diaphragm from T8 or vena caval opening. On the left side, it lies on the left.
Can you please tell me the parts of each lung, right and left?
Yes, ma'am. Right lung is divided into 3 lobes by
By
transverse and oblique fissure.
very good. And the left one.
Transverse and oblique fissure. Left lung is divided by oblique fissure into 2 lobes,
Okay.
upper and lower.
Upper and lower. And what is lingula? It is part of which
Lingula
lobe?
is the small part, just
It's part of which lobe?
it is part of lower lobe, ma'am. Lower
Right.
lobe, ma'am.
Say it with confirmation, like don't be doubtful. Can you identify structure 2 over here? This is hiatus or opening for what?
Yes, ma'am. It's pulmonary artery.
Good. Okay, and 6 here.
So it's pulmonary veins.
Vein. Okay. Can you identify this 8? Please.
It's pulmonary ligament.
Yes. What is pulmonary ligament?
It's fold of mediastinal pleura which connects mediastinum to pericardium.
Okay, and serves the purpose of what? Allows
It's
expansion of?
whenever there is increased
Yes.
adequate expansion of pulmonary veins, when there is increased blood flow in pulmonary veins.
Okay, good. Can you please tell me how many bronchopulmonary segments there are in each lung?
There are 10 segments, ma'am, in each lung.
In each lung. Okay. What is the anatomical level of phylum of the lung?
So T5, T6, T7.
Yes. And with carina? T4. Okay.
And
Can
the
you
lower
tell?
border of T4.
Yes. Can you tell me about the pleura? Extension of pleura with regard to lungs, and how many layers of pleura there are?
There are 2 layers of pleura, parietal pleura and visceral pleura,
Yes.
with certain pleural commissures in between.
Yes.
And upper border of superiorly, the surface anatomy is same as that of the lungs, but inferiorly, pleura lies 2 rib spaces below that of the lungs.
Okay, good. Can you identify these structures that you're looking at?
It's
taken
yes,
from
ma'am,
another
it's,
book, but it's
it's lateral border of
what?
yes, ma'am. It's lateral surface of right and left lung, and also
Okay.
the lower 2 images they show mediastinal surface of
Very good.
right and left lung.
Yes. Would you be able to identify these arrows, number 7 and 9? Which lung would that be? Any
Yes,
idea?
ma'am. 9. This is right lung, ma'am.
Good. So these are fissures. What
Oblique
about
and transverse fissure.
Yes. And what about picture 2 on the right hand side? What is this arrow pointing at? So most likely
This is oblique fissure of left
yes,
lung.
left lung. Okay, good.
Yes.
Can you please tell me, just imagine there is a clot which passes which passes from the deep veins of the calf to the pulmonary artery. Can you imagine the course and tell me how it would come across?
Yes, ma'am. From popliteal vein, femoral vein, external iliac,
Yes.
common iliac vein,
Yes.
inferior vena cava,
Yes.
into the right atrium, then via
Yes.
tricuspid valve into right ventricle, pulmonary trunk, and pulmonary arteries into the lungs.
Good. I asked you about the pleura. Can you tell me the nerve supply of pleura or the innervation of pleura?
Yes, ma'am. Medially or mediastinal surface is supplied by anterior and posterior pulmonary plexus from phrenic and vagus nerve. and laterally it is supplied by intercostal nerves.
Okay, good, thank you.
Thank you, ma'am.
Started your timer and here is your question.